Hey everyone, welcome to another episode of the Dental Debrief with me and my best mate Maheer. We run a clinic called Azure Dental in Inglewood, Western Australia, and today we're going to talk about all things oral surgery in the dental chair. So Maheer, you don't do a whole lot of oral surgery. Do you want to run us through why that is?
So oral surgery is pretty intense, right? It's could be a lot of high risk complications. It's quite stressful to pull off perfectly, and I think it's like also a personality thing where my personality is more tuned to sort of detailed work, fine work, building bites, a lot of porcelain, that kind of thing. That's just my knack. What are the main surgical procedures we do at Azure Dental?
Yeah, I divide it up into sort of three categories. One would be surgical wisdom tooth removal. So that's because most people don't have enough space in the jaws for the wisdom teeth, so they get stuck below the gums and cause infection. So we have to remove those teeth. And they can be quite complex to remove because of nerves and things in the area, so you've got to be very, very careful when you're removing them. I'd say second category is the implant surgeries, which is when people are missing teeth. We put titanium screws and fixtures into the bone to support a new tooth. And the final would be cosmetic gum surgery. So whether that's people with too much gum and they've got a gummy smile and we have to surgically remove the excess gum tissue, or people with things like gum recession, where we're grafting tissue from the roof of the mouth and putting it onto the front of the teeth to fix those recession defects.
So Tim, you have so much surgical experience, but walk me through your first surgery. Do you remember your first surgery?
I remember my first surgical wisdom tooth that I did on my own, and that was about a month or two after graduation at my first job in Singapore. I remember just being so nervous, and when you're raising the flap and removing bone, I just remember being so stressed. Yeah. And when I eventually got that tooth out, I remember calling my friend into the room just to show her the empty socket because I was just so proud of it. And then I think it took me about 40 minutes to stitch it up, which is probably take about 2 minutes.
And so what's the most important thing you've learned out of all these surgeries?
So every wisdom tooth, we can get every wisdom tooth out. What gets me excited now is how patients heal and their experience afterwards. So when I speak to a patient and they say, I honestly didn't have that much pain, I'm not even that swollen. Like, to me, that's the difference between a good surgery and a bad surgery. Mm-hmm. We can always get the tooth out, but the question is, what state is the patient going to be in afterwards? And what we're aiming for is minimal pain, minimal swelling, which is all about really careful surgical technique. Yeah. What about you, Maheer? You decided a couple of years ago that you were going to focus on cosmetics and porcelain. But do you remember your first sort of surgical tooth extraction?
I remember it so well.
Yeah.
I mean, it was maybe 3 or 4 weeks out of uni, and I'd just got my first private practice job, and they put me on Saturdays, and I was just there by myself in this huge clinic, only dentist on a Saturday. And then I had to take out this 2/6 upper molar, and as soon as I took it out, tooth broke into a million pieces right at the gum line. So I was like, there's nothing for me to hold on to. So I was like, I think I remember from a lecture we can section these teeth, and I was like, had to recall a lecture from 2 years ago in 4th year surgery, just how to section the tooth. Eventually you do get it out, but it was like a 45-minute battle, went through lunch, had to cancel the patient after. And yeah, that was my first experience. So,
because that's the problem, is at university, I think people don't realise that we don't do a whole lot of extractions. You might graduate extracting 2 or 3 loose teeth, and suddenly you're out there doing these incredibly hard, complex extractions, and you're on your own, and you're expected to, sink or swim.
Yeah, and you might have learnt it 2 years ago, not even in the year before. So you have to just remember, close your eyes and remember the slides. I think you have to cut that way and this way. I got it right. I actually got the tooth out, but yeah, it was freaking hard. It was really hard. Any advice, if you were talking to yourself 10 years ago, what advice would you give yourself for your first surgery?
I mean, as a young dentist, you often don't have any support, so you just have to dive in. And at the time, you sort of got no choice. Looking back, I wish I have had more mentorship available, someone looking over your shoulder to give you a hand. So as a new graduate, if you can find a job with a dentist who does a lot of surgery and you can watch them and look over your shoulder, that's incredibly beneficial. For me as well, I knew that during our degree we didn't get a whole lot of experience with extraction, so I did everything I could to follow oral surgeons around. So I made sure I had their numbers and I'd message them on weekends or end of day. If any emergencies come up at the hospital tonight, can you let me know so I can come down and assist? And did that a lot, so I'd be, get a call from the registrar at 2 o'clock in the morning. We've got an extraction on at the hospital. Do you want to come down and watch? And I'd just be in my car heading down there just to get as much experience as possible. And when you're a student, you know, that opportunity is available for you. You just have to be gutsy enough to put yourself out there and ask. So Maheer, what about you? For a new graduate coming out, what advice would you have for them in terms of approaching their first surgeries?
Yeah, so like you said, experience helps so much. And for me, I found my competence in extractions and minor surgery from doing a charity trip in India. So I went to India for about 3 weeks and we were just pulling teeth out all day. And we had no x-rays, we had the worst instruments, but you just have to make do.
Yeah.
And that helped my technique so much that I know I could take out a tooth with the most rubbish instruments, no x-rays. That now when you have all the good tools and x-rays and 3D x-rays even, you feel so much more confident. And
yeah, huge difference between you know, being in the middle of nowhere in India, doing a charitable job, and working in a state-of-the-art clinic where we've got all the tools available.
Exactly. Yeah. Thanks for tuning everyone out for our latest episode of the Dental Debrief. My name is Maheer. This is Tim. If you have any questions about oral surgery, dentistry, Azure Dental, anything like that, just drop a comment below and we'd love to help.